Your doctor has recommended a coronary angioplasty with stent placement procedure. Before we talk about this procedure, let's review some information about your body and why this procedure may be needed. Your heart is in the middle of your chest, under your ribs. It is the muscle that pumps blood to the rest of your body. Blood flows through tubes called blood vessels. Arteries are strong blood vessels that carry blood from the heart to all parts of the body. Veins are blood vessels that carry blood back to the heart. The heart muscle is supplied with oxygen-rich blood by two coronary arteries. There is a right and a left coronary artery. These arteries can be blocked by plaque. This is called coronary artery disease or heart disease. Plaque is made of fat and calcium that builds slowly over many years. Severe plaque blockages cause chest pain and heart attacks. Treatment of coronary artery disease is based on several factors, including your other existing medical problems, particularly diabetes, as well as how many arteries are blocked and how severe, and where the arteries are blocked. Non-invasive recommendations can include lifestyle changes like improving your diet, starting an exercise routine, and finding ways to manage your stress. Also, quitting smoking and making changes in medications. Common procedures to treat coronary artery disease include open heart bypass surgery to replace blocked arteries and angioplasty to improve blood flow through the blockages. A heart catheterization procedure or cardiac cath is needed to decide which treatment option is appropriate for you. A cardiac cath is the first step of an angioplasty procedure. It may be recommended when a blockage is suspected with a heart attack, chest pain, and shortness of breath. To do a cardiac cath, a cardiologist places a thin tube called a catheter through an artery in your leg or arm to reach your heart. The femoral artery in the leg is commonly used. The catheter is inserted into the artery in the groin, then guided to reach the heart. The radial artery in the arm is another site where a catheter can be placed. The catheter is inserted at the wrist, then guided to reach the heart. Which artery is selected for the procedure depends on your personal situation and the experience and training of your cardiologist. Contrast dye that can be seen with an X-ray machine is then given through the catheter. X-ray pictures and video show the contrast dye moving through the heart and coronary arteries. If appropriate, an angioplasty is done. This procedure makes use of the catheter to guide tools to open clogged arteries. Wire mesh stent devices may be placed. An open bypass surgery can be necessary or become your only option based on findings during the cardiac cath, for example, large blockages and bleeding. Open surgery is more invasive and has a longer hospital stay and recovery. Now let's look closer at the coronary angioplasty with stent procedure. To start, you will be positioned carefully on an X-ray table. You will be given medication to help you relax since you will be awake for the procedure. The skin over an artery of your leg, arm, or wrist is cleaned, then numbed with local anesthetic. You will feel a sting and burn that lasts only a few seconds. A small cut is made over the artery and a guide for the catheter is placed. You may feel pressure, but you should not feel pain. A long catheter is then placed in the artery and guided to reach your heart. Dye is given through the catheter and the X-ray camera is used to watch it flow through your heart. If the cardiologist identifies an artery to be treated with an angioplasty procedure, the catheter is guided to the blockage. A guide wire is placed through the catheter to the site. A deflated balloon catheter is positioned in the blockage. The balloon is inflated, pushing against the plaque and opening the artery for more blood to flow. The balloon is then emptied and the catheter removed. If a stent is to be placed, a balloon with a wire mesh device is guided into the blockage. The balloon is filled, opening the artery and putting the stent into position. The permanent stent supports and holds the artery open after the balloon is removed. If there is more than one blockage, the catheter is moved to the next site and the process is repeated. At the end of the procedure, blood flow through the treated arteries is checked. Then the catheter and guide wire are withdrawn. Gentle pressure, a stitch, a patch, or a plug is used to prevent bleeding from the artery. The incision is covered with a dressing. After the procedure, speak up and tell your care team if you have more than expected pain or problems. If your leg artery was used for the catheter, you must lie flat for up to 6 hours after the procedure to prevent bleeding from the site. How long you must lie flat depends on how the artery was sealed. If the artery was patched or plugged, you may be able to move sooner. An angioplasty is a common, minimally invasive procedure. Rarely, serious problems can happen. Risks include having a reaction to the dye, bleeding, damage to an artery or the heart, stroke, heart attack, and even death. You are monitored closely during and after the procedure so your care team can recognize and prevent complications. You can help by telling the staff about any problems you are having. At the catheter site, mild soreness and bruising is normal. Rarely, bleeding and infection can happen. Help prevent problems by following your doctor's instructions carefully. During the first week after the procedure, rest as needed. Do not exercise or lift anything more than 10 pounds. Wear loose clothing and do not swim or soak in a tub. You may be asked to drink extra water and/or other liquids to help your kidneys flush the contrast dye from your body. What to drink and how much will be different for you if you have diabetes, a history of heart failure, or kidney disease. Keep your incision clean and dry. Remove the dressing as listed in your instructions. Wash gently and pat dry every day, and do not rub the incision. Call your doctor if you have a fever, worsening pain, swelling, or redness at your incision site. Call 911 if you have chest pain, shortness of breath, dizziness, bleeding that doesn't stop, and any other sign that you may be having a complication from the procedure. Hospital admission, medication, or surgery may be needed to correct some problems. Angioplasty is not a cure for heart disease. Keeping your heart healthy depends on you making lifestyle changes, not smoking, controlling your blood sugar and blood pressure. You may need to take aspirin or other medications for months or years to prevent a blood clot, depending on your situation. This is critical to prevent a stent from becoming blocked. To avoid cancellation of your procedure or complications from anesthesia or your procedure, your job as the patient is to not eat, drink, or chew gum after midnight, the night before the procedure, unless you are given different instructions. Take medications you were told to on the morning of the procedure with a sip of water. Follow instructions regarding aspirin and blood thinners before surgery, as you may be asked to stop or continue taking them depending on your situation. And arrive on time. You should be ready to verify or confirm your list of medical problems and surgeries, all of your medications, including vitamins and supplements, your current smoking, alcohol, and drug use, and all allergies, especially to medications, latex, and tape. Before you have this procedure, it is your job to speak up and ask if you still have questions about why it is recommended for you, the risks, and alternatives. also understand the risk of not having the procedure. This video is intended as a tool to help you better understand the procedure that you are scheduled to have or are considering. It is not intended to replace any discussion, decision-making, or advice of your physician. This video is about washing your hands to get rid of germs so that you don't spread infection. Germs are bacteria, yeast, and viruses that cause sickness and infection. They are so small you can't see them. Germs are always on your hands and can be spread to other parts of your own body, to the person you are caring for, and to anything else you touch. Wash your hands after you cough, sneeze, or blow your nose, handle trash, and after you touch anything bloody or dirty. You must wash your hands before and after you take care of a patient, touch their food or drink, and use the toilet. For good hand washing, you need to wash for 20 to 30 seconds, almost half a minute. You can time yourself by humming the Happy Birthday song 2 times. If you can see dirt on your hands, it takes even longer to get them clean. Don't rush. Rubbing your hands together loosens dirt and germs from your skin, and the running water washes them away. Pay attention to cleaning the tops and bottoms of your hands, between your fingers, and under your nails. Use liquid soap if possible because bar soap can have germs on the outside. Make sure paper towels and a trash bin are nearby. Remove jewelry from your hands, except a wedding band, and push your sleeves up. Turn on the water and wet your hands. Pump enough soap from the dispenser to cover your hands as you rub them together. Start counting to 20 slowly at this point, or hum the Happy Birthday song 2 times. Rub your fingers together, the backs of each hand, and around each thumb. Get soap under your fingernails by rubbing your nails against the palm or inside of your other hand. If your nails are dirty, clean under them. Keep rubbing your hands together until the end of your count. Rinse your hands completely. Because the sink has germs, use a paper towel to turn off the water. Throw away the paper towel. Use a new paper towel to dry your hands completely. Then throw it away. If soap and water are not available, you may use alcohol-based waterless hand sanitizers. Use enough sanitizer to cover your hands completely when you rub them together, and keep rubbing them together until they are dry. Waterless sanitizers kill most but not all germs. Sanitizers are not as good as soap and water for germs from diarrhea, especially a bacteria called C. diff. They also do not work if you can see dirt on your hands, or if they are wet from blood or something else. Key points to remember with hand washing are to use soap from a pump dispenser. Rub your hands together for 20 to 30 seconds, and rinse completely with water. Remember, with waterless hand sanitizers, to rub in until dry, that they are not a good choice if you see dirt on your hands, and that they do not kill all germs, especially those from diarrhea. This video is intended as a tool to help you better understand the care instructions that you have been given. It is not intended to replace any specific advice or personal care instructions that you have received from your care team. If you have any questions or problems, please be sure to call or be seen. This video is about basic wound care for your uncomplicated surgical wound. This includes information about cleaning a wound, changing a bandage, and preventing infection. A surgical wound is a cut in the skin that was made during surgery, also called an incision. Follow your doctor's instructions about when to take the dressing off, when it is safe to get the incision wet in the shower, how long it needs to be covered with a dressing. Most incisions do not need to stay covered after the first few days, but they do need to stay clean. To remove an old dressing and clean a wound, you will need a clean surface for your supplies, clean water, disposable gloves, mild liquid soap, and clean washcloths or gauze pads. Start all care by washing your hands with soap and water for 20 seconds and dry them. If you are caring for another person, put on disposable gloves after hand washing. This is for your own protection, even if you are caring for a family member. To remove the dressing, gently lift and peel the tape edges toward the incision. Use your other hand to hold and support the skin while you pull the tape. If the dressing sticks to the wound, wet the dressing with clean water and let it sit for a minute. Lift the tape and dressing off together. Check the dressing for drainage and odor. Place the dressing and tape in a sealed plastic bag before putting it in the trash. Remove your gloves. You may need to change them sooner if they are dirty and you need to touch something clean, or if there is a tear or hole in your glove. Before cleaning the wound, wash your hands and put on fresh, clean gloves. Look carefully at the wound. Call your doctor or nurse if the incision is opening or coming apart, if it is red, warm, or swollen, and call if it is draining and has a bad odor. Wet a gauze pad or washcloth with clean water and mild liquid soap. Avoid using bar soap to clean your wound because it can carry germs. If possible, avoid antibacterial and deodorant soaps as they may cause irritation. Alcohol, peroxide, and betadine can hurt new tissue and slow healing. With one stroke, clean the wound from top to bottom. Use a clean part of the washcloth or gauze for each stroke. Continue washing, slowly working away from the wound until the skin is clean at least 3 inches from the incision on all sides. If you have a large wound, you may need extra washcloths and gauze. Always remember to stroke from top to bottom. Use a new washcloth or gauze for a separate wound. To rinse the wound, wet a new gauze or clean cloth with plain water. Start at the incision and work away to remove any trace of soap, working top to bottom. Use a fresh gauze or cloth to dry the area without rubbing. Place all dirty gauze in a sealed plastic bag before throwing away. Take off and throw away your gloves. If they are bloody or visibly dirty, place them in a sealed plastic bag before throwing them away. Wash your hands with soap and water for 20 seconds and dry them. If you need to put on a new dressing, open a gauze package with clean hands. Do not touch the gauze. Place the open pack on your clean surface. Put on clean gloves. Pick up the dressing by the corners. Do not touch the center. Hold the gauze pad over the incision to position it, then lay it on the wound. Tape the edges of the dressing. Do not cover the center of the dressing with tape unless you have been told to do so. Take off and throw away your gloves. Finish care by washing your hands with soap and water for 20 seconds and dry them. If your skin is sensitive to tape, try paper tape. Latex-free wraps or binders can also be used to hold dressings in place. Ask your care provider for other options if this is a problem. If you are allowed to clean your incision when you shower, gently wash using the liquid soap. Rinse well with clean water. Then pat dry with a clean, dry towel. Call your doctor if you can't get the dressing off, if you have bleeding that doesn't stop, if you have a fever and chills and any other sign of infection such as pain or redness, worsening drainage, and a bad odor. Know that gloves can spread infection if you don't wash your hands first, if you touch clean items with dirty gloves, if you don't change to clean gloves before the next care step, and if you don't wash your hands every time you take gloves off. This video is intended as a tool to help you better understand the care instructions that you have been given. It is not intended to replace any specific advice or personal care instructions that you have received from your care team. If you have any questions or problems, please be sure to call or be seen.